So I'm joined by Mickreen Adhiambo, who is the program coordinator at TICAH Health. Thank you so much for making the time.
Thank you so much, Mwende, for hosting me.
So we can just start by letting us know what exactly the organizations that work for, what exactly you do, and what your role is there.
Yeah, and thank you once again, Mwende, for hosting me. The way you mentioned, my name is Mickreen Adhiambo. I'm a program coordinator with TICAH, and TICAH basically works on health. It's very broad from indigenous health and incorporating it to the contemporary world of health. But for the purposes of today, I'll speak about the work I do at TICAH, that other angle of health that TICAH works around, and that is advocacy on sexual reproductive health and rights. Advocacy when it comes to access to information and quality reproductive health and rights services for women and girls in Kenya. So that is what I'm currently doing, the advocacy part of access to reproductive health and rights for women.
Okay, let's get more into the advocacy. What kind of programs do you have under advocacy for women and girls?
Okay, currently we have in and out of school programs for girls, adolescent girls. And when I talk of in and out of school, it's for the girls in primary school levels, high schools, and now the university or higher institutions of learning, where we just have conversations around reproductive health. As basic as cleanliness, as basic as menstruation, to more complex conversations around now mature reproductive health for the women and girls who are way beyond adolescent. And out of school, we work with teenage mothers who are not in school, but they got pregnant early and they became mothers from as early as 10 years old. So we have conversations around, do they want to go back to school? If not, how do they improve their livelihoods as teenage mothers? How do they take agency over their reproductive health? How do they make informed choices about everything that is with regards to their health? And another angle of advocacy is that we work with community members, more so the informal settlements we began with informal settlements in Nairobi. That is Kawangware, Korogosho, Kibra, Majengo, and Viwandani, but that is now expanding. And that is the bit of community advocacy. But just to extend that, we work with parliamentarians because advocacy is a component of change of policies. And how do these reproductive health and rights policies affect our constituents, affect the audiences that we work with? So we work with community members and we also work with policymakers and ministries, that is of health and of education. And we also work with other like-minded civil society organizations.
Wow. Okay. Yeah. So you definitely have a lot going on.
Yes.
One of the projects, I don't know if I call it a project or a program, that I know that is under TICAH is Antigen Hotline.
Yes.
So I'm really interested in knowing how that came about and what the feedback has been for the hotline.
A brief background about the Antigen Hotline is it was born in 2013. It was way back. And it emanated from the conversations from now the constituents I mentioned, the women and girls in the informal settlements we were working with, because initially TICAH began as a HIV and AIDS organization, awareness organizations, and how people living with HIV and AIDS can get alternative medication and even diet. And from that conversation, the women and girls brought in issues of lack of contraceptives, gender-based violence and sexual gender-based violence in their relationships, in their setups, and the issue of unintended pregnancies and unsafe abortions came up. And then they were like, we do not have a place where we can have access to this information and services. And even if there are, even like, for example, the facilities, there is stigma.
Yeah.
There's no accurate information. Even the prices, like the price they have to pay to get the services was just too high for them. Now having that conversation, like, will we manage our HIV and AIDS life or will we prioritize this other aspect of life? But both of them are equally important. So from that angle, TICAH staff were trained on how to develop a hotline because the issue was, women and girls cannot have access to confidential, quality information and referral because confidentiality is number one. For example, if someone is seeking safe abortion services, I just can't come and say, I'm so and so and I need safe abortion services.
Yeah.
But that time, of course, the stigma that come around with reproductive health issues. So from there, TICAH staff were trained on how to develop and start up a hotline. And of course, it began with prepaid, with mobile phones, and people just calling in, and the counselors handling all the calls that were coming in at that time. So that was the motivation behind Antigen Hotline. Women and girls just having access to information, quality and confidential, and also access to services around reproductive health.
Okay. This is going to be an interesting question, but why Aunty Jane? Could have been Auntie Mary, Auntie. Why exactly Aunty Jane? Was there a particular reason for that?
Not really. Jane was just another Kenyan name, another name in the streets. And we're like, yeah, why not Aunty Jane? It was the simplest
Yeah.
name out of Mary, out of Grace. Like that Jane just popped in and we're like, yeah, Aunty Jane works.
Okay.
Yes.
So let's just circle back to reproductive health from the work that you're doing at TICAH and also the work that's been done at Antigen Hotline. What are some of the key things that you get, like in terms of the callers? What would you say are the issues that they're more focused on when they call in?
Okay, first of all, I'd just like to talk about the audiences because the people who call in, majorly, of course, are women and girls
Yeah.
from their the adolescent age, like as low as 11 to as
Wow,
high
okay.
as 50. Because even from our data, we've like gotten 55. So just like women and girls in their reproductive ages. And the conversations or the information requested for varies from contraception, like and contraceptives, how to use,
Yeah.
the myths and misconceptions around contraceptives, where to access, to even gender-based violence, sexual gender-based violence, how to manage that, how to report, the whole process around that, pregnancy crisis management, unintended and unwanted pregnancies, and of course, how to seek safe abortion. And one thing I'd like to say is that the project is not like a medical platform.
Yeah.
It's just an information provision platform. So these are some of the reproductive health issues and information requested for by the audience and the callers who call in at the hotline.
Wow. So when it comes to the callers that are calling, you said it's mostly geared towards women. Is there a difference in terms of the issues that people are calling for? Because I can imagine you're saying someone who is 11 and someone who's 55. What are the kind of like differences in terms of the age groups? And then are there also men calling or it's just women?
There are also men who call in. And in terms of the diverse issues, of course, looking at the demography, most of the adolescents call in on issues to do with menstruation and sexual gender-based violence. Like sexual abuse really comes a lot, even from the conversations that we have in schools. Because of course, in schools, it's not a platform where they'll open up about these things. So when it comes to sexual harassment, sexual abuse, and menstruation, the young girls, the ages of maybe 9 to 15 or 16, call in on menstruation and sexual gender-based violence and sexual harassment. But again, there are instances of unintended pregnancies, a huge instance of unintended pregnancy, because from sexual gender-based violence and someone who does not know how to manage sexual gender-based violence, an
Yeah.
unintended pregnancy is an outcome. So like how to manage that, how to go through that process. And in terms of unintended pregnancy, cuts across from the adolescents to the plus 50-year-old women who call in on just managing unintended and unwanted pregnancies. Something else that also comes in is gender-based violence. And I've talked, I think, about contraceptives because there's so much myths and misconceptions around contraceptives. So just people calling in and asking more information and where to have access to these services, that comes in a lot. And men also call.
Yeah.
Men also call to ask for information on gender-based violence. There are men who've also called on incidences of sexual gender-based violence. There are men who've also called in on issues to do with STIs and HIV management, and even relationship issues. Like they're just calling in and like, I just need someone to talk
How to vent.
You know, I just need a platform to vent, someone who does not know me, but they can listen in. So, as much as our primary audience is women and girls, the hotline does not discriminate against men and boys who call in. And some even call in on behalf of their partners.
Wow,
Like they just need information as a couple. So the man calls in and they're like, please provide the information for the both of us.
So, what would you say are the biggest issue when it comes to sexual and reproductive health? I think you've touched a little bit on it on the GBV and contraceptives. Are those the biggest issues when it comes to what are the biggest issues?
Unsafe abortion,
Wow. Okay.
unsafe abortions, access to youth and adolescent friendly services. And when you talk about youth and adolescent friendly services, it's issues to do with, again, contraceptives, counseling, STI and HIV. But unsafe abortions, the conversation as a society, we always shy
Yeah.
from having. It forms a huge basis of the calls. And when it comes to unsafe abortions, the legal provisions, what the Constitution says,
Yeah.
what are the provisions, the legal provisions around access to safe abortion and post-abortion care.
Wait, so people call you to ask you what the provisions are?
Yes, people call the hotline.
And so, yeah, I mean, like
Yes.
you, like your organization. So they
Yes.
call in to literally be like, what are the provisions for abortion in Kenya? Where can I? Okay. And that is the biggest conversation, basically.
Yes.
Okay.
Yes. People call in just to know what the legal provisions are, how they can have access to safe abortion, even under the legal provisions, of course, after providing what the law says when it comes to access to safe abortion, they're like, we really need these services.
Okay.
And that is also one motivation, because when we talk about stats, like just thinking about the many women and girls who lose their lives, and I always say needlessly,
Yeah.
from complications
Yeah.
of unsafe abortions. Like it's a conversation that we really need to have. Despite the legal restrictions, there are also other bit of the legal provisions that allow for access to the
Okay.
same.
Let's go into those legal provisions. What are the legal provisions in Kenya when it comes to safe abortions?
I am not a lawyer, so I won't start quoting. You know, we like
What's in
saying
the Constitution?
article, what the Bill of Rights says, this and that and that. But one thing I'd like to say, and I'd like to put emphasis on, is access to safe abortion is legally restricted,
Yes.
but not illegal. That is one thing I'd like to say. And it's restricted to if the health of the woman is in danger. And maybe if you've been following the conversations, I think it was back in 2019 or 2018, there was this huge 5-bench
Yeah.
ruling
Yes, I remember
on
that.
breaking down what health means
Yes.
under the WHO guidelines. And health is not necessarily the absence of physical
Yes,
affirmatives, you
yes.
know? So it's physical health, mental health, psychological health, emotional health, and even social health. That is one conversation we really miss having, because most of us focus on the physical health. So if the health of the woman is in danger, they're allowed to terminate, to have access to safe abortion. 2, if the pregnancy is as a result of sexual violence,
Yeah.
that is either rape or incest or any form of sexual violence, a woman or a girl is allowed to have access to safe abortion under those conditions. And even the Sexual Offences Act allows for such, provides for such, and it broadly speaks about the sexual offenses. And thirdly, if the termination is done under the supervision of a qualified, trained medical profession. And when you talk about a medical profession here, it's not necessarily a doctor.
Yeah.
It can be a doctor, it can be a nurse, It can be a trained midwife or a clinical officer.
Mm-hmm.
And another legal provision is if it's allowed by any other written law. Kenya, we are a state party to so many
Yeah.
regional
Yeah.
and international laws. We've ratified, we've domesticated. So if it's written under any other law that binds us, a woman is allowed to seek for safe termination under those provisions.
Okay.
Yeah.
Well, that's interesting. That abortion is at the top of the list of queries that people bring up. So let's talk a little bit about. You said that there's a lot of myths around sexual and reproductive health. What are some of the myths that you've come across?
One is that more so on contraceptives. Wow, that is just so huge. That contraceptives cause infertility and barrenness. That anyone who is sexually active but does not have a kid already should not use contraceptives. That contraceptives make someone cold. You know, so one thing I'd like to state is
Wait, sorry, cold.
yes,
What
like
is cold?
baridi. That is
Oh, okay, frigid. Like okay.
So I'm like, I try to understand what baridi in this instance mean, and I'm like, I fail to understand, and there's no scientific backup on the cold,
Yeah.
whatever cold means. So that has really affected how most so young people have access or seek information on reproductive health. Because, of course, the first point of interaction and the first point of having access to information is peer to peer. Whatever my friend says goes.
Yeah.
And then after peer to peer, I go to Google. What does Google say? Of course, even me as I am, when I'm stressed, I'll be like, I'm
Yeah.
having signs of headaches and sore throat. What does that mean? So whatever Google tells me is the gospel truth. But these information are perpetuated in the conversations people have outside there. And it really is an impeding factor to these constituents having access to the reproductive health. Again, another thing on myths is anyone who's had access to safe abortion will be infertile or will never have a chance of conceiving again. One thing I'd also like to say is medically speaking, from the research and the books we've read, is that immediately after a safe abortion procedure, the chances of a woman getting pregnant again is as soon as after 14 days of safe termination. So that is again one myth that always comes about. And of course, the myths on GBV, like when the perpetrator violates the victim or the survivor, the victim should just like stay back, should just hold on, should just like fight on. It's normal more so for a woman to, it's quote unquote normal for a woman to stay in a violent relationship. And even when someone seeks information on GBV, they're like, but where will I go to? I
Yeah.
do not have an option out.
Yeah.
I cannot walk away. Like, they were just angry. I'm the one who poked them, you know? And just breaking that notion of the victim always taking the blame. It's a conversation that we constantly have just to break these myths and misconception around these reproductive health issues.
Well, I'm just thinking about my own in terms of education growing up and how I learned about sex or even reproductive health. And I can't really put a finger on like a particular expert talking to me, or like the education was very scattered is what I mean. So, I don't know what your experience was, but mine was, I think the first thing was finding out about periods. So menstruation, the first thing. I think we used to have this, I think it was mostly teachers and maybe like the guidance counselor or something like that. Then you separate boys and girls. I don't know what the boys used to be told, but the girls go and you're mostly just told about, okay, you're going to get, I think I was in class 4, you're going to get periods. And then you're told this is how you're shown, this is how you put on a pad. When you need one, when you'll need to come and talk to a teacher, they'll give you one. and then or don't have sex. Don't. It was even don't have sex. It was don't let boys touch you.
Yep.
Don't let boys touch you. You're not big girls. And then it's sort of like more couched in fear, a lot of fear and shame. And then now when you get a little older, like when I was now in high school, it's even a bigger deal because now it's literally don't get pregnant. And then on and on. So you never, I can't really remember having proper sexual and reproductive health education. I mean, we learned something in biology, but it was more of, the science behind how a baby comes to be, but not necessarily, okay, this is how you're supposed to take care of yourself. This is how you're supposed to, even things like, you're supposed to get a pap smear. You're supposed to, how to know if there's something wrong, like if you have maybe an infection or a UTI or something like that. There was nothing. I literally learned all these things through Google and through my friends. Or eventually when you're going to a gyna and you ask the gyna, okay, so X, Y, and they tell you, oh no, that's, So it's so strange because I would say that I think when I compare myself to the average Kenyan, I probably would say in terms of the opportunities I've had to access education, above average. So I wonder if I literally was not getting great sexual and reproductive health education, what about majority of young people who honestly they don't have that access? Maybe even they don't even have access to they can now have access to a gyna. That's expensive for a lot of Kenyans. So that's where I'm kind of like, how do we kind of rectify that? Because it's really alarming.
Yeah. And I'm glad you've brought that up, the issue of menstruation. And let me tell you, even up to date, we're in 2021, and we're still having the conversation around, number one, period poverty, period shaming. And even young girls are like calling in. I'm not even so sure of what the education system right now speaks about menstruation, because sometimes they're calls and they're like, I am bleeding. Is it normal? And then
Wow,
you're like,
okay.
how old
So
are you?
they-
I'm 11. Is
Okay.
it normal for me to bleed? Is it normal for me to have cramps? And then they're like, we were told that you do not sleep with boys, like literally sleeping. If you sleep with boys, you'll get pregnant. I think that was one thing I was also told back in my days.
Yeah.
And when it comes to sex, they're like, okay, fine. I got pregnant, but I never slept with the boy. We only had sex while standing, you know? And a kid speaks to you and they're like, how did I get pregnant? And we never really had a total penetrative sex. They just tipped the vagina,
Yeah.
And it's shameful and heartbreaking when there's still myths and misconception around sex, around menstruation, around pregnancies, even in 2021. And of course, with that happening and these constituents not having access to information is more heartbreaking. And now when you're talking about reverting this whole thing, number one, uh, age appropriate comprehensive sexuality education. Age appropriate comprehensive sexuality education provides a space more so for the adolescent. Number one, I also talk about agency. What information do they have outside there? Is the information they're having outside there correct? And is the information they're having there outside there age appropriate? When it comes to age appropriate, nowadays, everyone or most people have access to the internet. Some are not even rated.
Yeah.
And whatever information young people get outside there, they run with that. But how do these adolescents and young people have access to age appropriate comprehensive sexuality education? What do I tell a 9-year-old and what do I tell a 16-year-old? Access to comprehensive sexuality education also allows these people to make informed choices, to even delay their
Yeah.
sexual debut, because studies have it that the earliest sexual debut is an 8-year-old. And I asked myself, where was I when I was 8?
Yeah, that's like a class
Class
or
2.
class 3. Yeah.
And if this is happening, what information do they have? When can they say no? When do they have even that ability to say no as young as when they're 8? If they're vulnerable to sexual violence, how do they communicate that?
Mm-hmm.
What is an inappropriate touch? Where and how can this adolescent have access to information and services in case they've been defiled? So, like, access to comprehensive sexuality education allows for these people in their age brackets,
Mm-hmm.
one, have access to correct information about sexual reproductive health, have agency over their reproductive health, make informed choices, and the way I've said, delay sexual debut. And if they're already sexually active, because truth be told, we cannot bury our heads,
Yeah.
kids are having sex like as young can be.
Mm-hmm.
A 5-year-old, a 4-year-old will show you some dancing styles, and you're like, where?
Yeah.
How did they learn
Mm-hmm.
about this? Having open conversations, and it starts from the home setup. And I wouldn't want to assume everyone has a home setup.
Yeah.
For the people who are in home setups, for the people who are in guardianship setups, like just having these conversations. This and this is happening. If someone touches you like this, come and tell me. Even if it's the teacher, come and tell me. Even if it's the neighbor, just creating that safe space. Comprehensive sexuality education is not really about the curriculum in school.
Yeah.
It's about the small conversations we have in our societal units, in our community units. And that really helps avert this. Number two is access to friendly services. When I talk about friendly, I talk about adolescent, youth, and of course, adult friendly. Because sometimes we think adults have it easy. But there's something called like the service provider's attitude. You're
Mm-hmm.
walking in and someone is like looking at you. Where? You don't even have a kid. Why are you looking for contraceptives?
Yeah.
You're an adolescent. Why are you even looking for a condom to start
Mm-hmm.
with? And then you're shamed in that facility. Watu wa condom, kujeni hapa.
Mm-hmm.
Watu wa family planning, kujeni hapa. You know, that attitude, changing that and just making sure that these people who need the information and the services have access to it, feel comfortable working in these spaces. Because we have conversations with youths and they're like, where? The facilities are not a go-to place.
Yeah.
You maybe get even old people there who like stigmatize you. They know your family and they'll just end up saying, so and so came in for contraceptives, they're having sex. So and so came in for condoms, they're having sex,
Mm-hmm.
and they're like young. So just having these conversations to change the attitudes of the providers to allow for these groups of people have access to the information and the services is really super critical. And in terms of even access to information, that is why platforms like the Antigen exist. Sometimes it does not really have to be a one-on-one,
Yeah.
but just giving that confidential information. You're calling a counselor on that other side of the line, and they're like, how can I help you? Someone personalizes that, someone empathizes, and they give you information and referrals to a provider who will help you at the end of the day. That has really come in handy, trust you me.
Okay, so let's just talk about a bit more about we're talking about the education part,
Mm,
age appropriate education. I
mm,
know there's been a lot of pushback on educating, especially teens and kids,
mm,
children,
mm,
on sexual and reproductive health.
mm,
I don't know if I want to go in deep about that. I know there's a lot of cultural and religious reasons
mhm,
for why there's a pushback on educating children on sexual and reproductive health.
mhm,
But obviously, there's a need for it because
mm,
kids are having sex
mm,
and also are predisposed to possible sexual abuse. And so they
mm,
kind of need to know what is what.
mm,
What would you say, just to break it down a
mm,
little bit, are some of the, like, especially for parents,
mhm,
parents who might be wanting to get a bit more involved in the sexual and reproductive health education of their children?
mm,
Just simple things like when they're, let's say, 4, this is what you should be telling them. When
mm,
they're 9, this is what you should be telling them. When
mm,
they're 13 or whatever, until
mm,
they're, even as adults, this
mm.
is maybe when they're 18 or 19, this is what you should be telling them.
I always say it's as simple as knowing if your kid has a crush in school.
Mm-hmm.
Like, I like this girl, I like this boy. They bring me snacks, I share my snacks with them. Then you'll be like, oh, so you like them. What do you like about them? Like, first of all, you're putting as parents putting ourselves in the shoes of the kids just to try and understand things from their point of view. Because once your kid comes and tells you have a crush in school, and then you're like, that is tabiambaya, that is bad manners. You should not be crushing on people in school. They'll coil down, they'll be scared, and they'll never talk to you.
Yeah.
And if the first safe space is not safe at all for them, they'll never speak about anything, leave alone their vulnerabilities and even instances of sexual abuse. They'll be like, my parents are a no-go zone. My teachers are also a no-go zone. So it's as simple as having those small conversations, knowing how your kids are at school. And when they're getting to puberty, you're like, it's normal. The growth of breasts, it's normal. You will get these changes, because I will not assume that all schools teach about these whole processes like intensely. And just talking about body changes are normal, sexual attractions are normal. But how do you, as an adolescent, as someone who's getting into teenage, able to handle whatever sexual feeling is coming through, whatever bodily changes is coming through, whatever emotional feelings comes through with the whole process? Just having that space of having conversations and listening to their point of view. Sometimes it's not much that is needed from the parents, just the listening ear and the empathy. And that provides, I'll still put emphasis on the safe space back at home. And when it comes to teachers, like having the conversation as it is, depending on the, again, clusters of classes and of pupils one is handling. If a child talks about maybe their sexual experiences, the guidance, we've talked about guidance and counseling, and I think guidance and counseling teachers still exist to date. Though I'm not so sure if they're trained, but they exist to date. If a child comes to you and they're like, I'm having A, B, and C, listening to them. If a teacher feels they are not equipped enough to provide quality education, they refer. They work with the children step by step to ensure that the children have appropriate information and services on whatever issue they have raised. And in terms of the pushback, I always say reality versus morality. Morality is so relative, and I won't really go into that.
I love that. Reality versus morality.
I really won't get into the definition of morality. We are from different cultural backgrounds, we are from different religious backgrounds, but the reality is we are having teenage pregnancies. We are having sexual gender-based violence cutting across from adolescents to the adults. Like, you can imagine 1 in every 5 15 to 19-year-old is either a mother or is pregnant. And how do we have these conversations? Last year during COVID, the uproar on the incidences of teenage pregnancies, the numbers that were there. And instead of having the back and forth blame game, how do we address this? Because these things are real. And the teenage pregnancies are coming from peer-to-peer relationships, because we will not assume that all the teenage pregnancies are as a result of sexual violence. They come from peer-to-peer relationships, and of course a huge number from sexual gender-based violence, more so from people known to them. But how do we provide platforms for these vulnerable populations to have access to information, to know when and where to seek for information and services? Like us providing a mechanism, a redress system at our every capacity, whether as civil society organizations, whether as parents or guardians. Even the government has its role to play. As we ask the government to play its role, what are our roles? So it's having the real conversations. Kids are having sex. Kids are vulnerable. There are some people we call mature minors who are already taking adult roles, whether it's from avoidable or unavoidable circumstances. How do they have access to this information? We will not forget the child-headed households. They are minors. They are sexually active or whatever, or they're predisposed to sexual violence, we cannot forget to have the conversations about the intersectionality across reproductive health and rights.
Yeah.
Because even if we focus on one group, we are forgetting these other groups and these other many factors that predisposes these groups
Yeah.
to the gaps and disparities that exist. So it's all about, number one, acknowledging the reality, doing an intersectional needs assessment, and just ensuring that these groups across the divide have access at least to quality information and services. I mean, it's just the basic human right. And our
Yeah.
constitution says it, like, every human, just by the virtue of being human, is entitled to having access to quality healthcare, including reproductive healthcare.
So, I mean, you've brought it up already about the teenage pregnancies that were kind of became a news story last year. And, the COVID pandemic was one of the reasons that people said that the numbers have gone up. What other things have you seen, or have you seen anything like the shifting of the issues that are being discussed, like whether it's people calling in to the hotline or just generally with the work that you guys are doing in terms of the pandemic? Has the pandemic made the issues worse, or are things a little better?
Worse. Worse in terms of, okay, I'll talk of worse and better, but I'll start with worse because that really came out strongly last year. Number one, with the pandemic, the restriction of movements
Yeah.
and the lockdowns, these groups of people could not have access to whatever healthcare, leave alone reproductive healthcare services that they needed. And that really affected these audience a great deal. Whether it's for refills of the ARVs, whether it's for changing of the contraceptives, whether it's accessing safe abortion and post-abortion care, whether it's accessing GBV response, more so on the GBV, as much as it really cut across, but there were no redress system. Like, if you experience violence, by that time it was the first time it was 7 to 4 in the morning,
Yeah.
the first
Yeah, the
curfew,
first curfew.
and the lockdown. Anything that happens in that time, there's
Yeah.
no way. You'll just have to wait until the next day. And this COVID situation added fuel. Like, people who are vulnerable to sexual violence had no option but to stay with the perpetrators, because the perpetrators are people known to them.
Yeah.
Schools were closed, people lost their jobs, they had to stay at home with their frustrations. Others are like, being violent is a way for me to vent. But these survivors and these victims had nowhere else to go. They were like, we don't have anywhere else to go. He's the one who provides, or she's the one who provides. And for the school going pupils, were like, the schools were our safe haven. But
Yeah.
now we do not have anywhere else to go. We'll have to be here. Parents lost their jobs, and some parents are like, you go out, look for job. Everyone has to complement
Yeah.
our finances, whatever it is you do. And that was a breeding ground for, number one, violence, sexual exploitation. Like, COVID really exacerbated the whole situation. And in terms of, I've also talked about access to these services and information. Fine, the information was readily available, but now the linkages to the facilities
Yeah.
was a huge challenge. And I think even from the news last year, 68% of women reported GBV incidences. And you can imagine, these 68 are only the reported ones. How about the
Yeah,
unreported
unreported,
ones?
yeah.
And the 34% of men who reported, good thing the men were also coming out. But how about the incidences that were unreported? We were talking about femicide. We were talking about the many killings. We were talking about the increased incidences of gender-based violence and sexual gender-based violence. They have said, like, it was a breeding ground for violence. COVID really made the situations worse. But again, it also opened spaces for digital communications. On the flip side, everyone was on social media, having communications and engagements on social media. But again, to look at it, What about the people who do not have access to internet, who
Yeah.
do not have access to social media? They were really left behind in that period as systems tried to re-strategize and
Mhm.
ensuring that all these populations have access to information and services. So COVID really struck it hard before we adjusted, before the community engagements were halted, you
Mhm.
know, the restricted numbers, we could not reach out to our constituents, even within Nairobi, leave alone outside Nairobi. So generally, COVID made things worse a lot.
Okay. So what would you like to, in terms of the work that you're doing, see more of, that you feel that would be, okay, we're moving in the right direction now? Is
Mm.
it maybe, the sexual and reproductive health, whether it's the bill, or, moving forward, or is it having people more interested in the conversations that are
Yeah.
going around reproductive health,
Mm.
especially post COVID?
Mm. Personally, I feel like having these conversations, having the real conversations go a long way. And I'm glad that people are opening up, including men, like just having this real conversation. Women and girls are being affected, men and boys are also being affected. How do we have these real conversations moving on forward on the urgency and the need of access to reproductive health care, cutting across? So just having that conversation in our small units will really, really go a long way. And it's something I'd love to see. Again, in terms of policies, because it's gotten to a point where service providers, and when I talk about service providers, more so the medical service providers, are conflicted between the existing policies and service provisions. And it's been a challenge, I know, even on offering safe abortion services.
Mm-hmm.
The constitution says this, the health bill says that, the reinstated standards and guidelines on reductions
I
of
am.
maternal mortality
I
says
remember
this.
there was the court case
Yes.
around that.
Now, even the conflicts that arise and the clash on policies and laws, policymakers just being so deliberate, whether it's the parliamentarians, whether it's the concerned ministries, just being so deliberate to ensure that, as much as we're talking about healthcare, as much as we're talking about UHC, as much as we're talking about Vision 2030 and the Big Four agenda, we will never address number one, maternal mortality, if we do not talk about safe abortions, because safe abortions are among the leading causes of maternal deaths.
Mm,
And not having that conversation does not make anything better.
yeah.
And we will not talk about teenage pregnancies or sexual gender based violence among adolescents and young people if we do not have the comprehensive sexuality education conversation.
Mhm.
And just having that conversation when providing truthful information really helps go a long way, because every other time we're burying our heads, kids every other day are being predisposed. Uh, every other time they're being sexually violated. Leave alone kids alone. Every other time we'll be talking about teenage pregnancies. Every other time we'll be talking about FGM. And the good thing is the president made a commitment globally. And then it was the Gender Equality Forum in Canada
Yeah.
some time back.
Yes. Yes.
And he made the commitment about uh, putting in financial support and human support and whatever support in ending FGM and GBV. Was it by 2022? 2022 is just the next
Yeah.
year. Where are we as a country? So just making and having deliberate conversations around these issues, because they are all interlinked.
Mm.
Harmful cultural practices are interlinked to other reproductive health components of living. Like just having that deliberate conversation and deliberate political will to at least push forward the policies that champion for these issues. Like that, if that is a conversation that we'll have as a society, it'll really go a long way. And it's something called values clarification. Fine, we're having different values, and my values are necessarily not the same as yours.
Yeah.
But when having the real conversations, we're like, this is happening. how can we readjust?
Yeah.
How can we have attitudes transformation?
Mm.
Because we are so much held to our beliefs, which is totally allowed.
Yeah, but
But
they're not
again,
helpful.
how does it affect the next person?
Yeah.
How can I help?
Hmm.
You know, and that is what humanity is all about.
Okay, so for someone who's watching and is like, okay, I want to get involved in sexual and reproductive health advocacy, do you have any ways people can plug in into the work that you guys are doing? Like, is there a hashtag maybe people can follow and amplify? Are there, donations? Are there programs that people can get involved in?
First of all, I'll talk about the Antigen, of course. There's the hashtag Bongana Antigen.
Mm-hmm.
And Bongana Antigen is that hashtag where we have conversations across all social media platforms: Twitter, Facebook, Insta, just having that conversations on reproductive health. And we have very bold conversations around reproductive health. Bongana Antigen is that space, the way I've said. And when it comes to hashtag, there's so many hashtags. There's SRHR KE, there is Abortion is Healthcare KE for people who want to do advocacy on that. There is I am for CAC KE, like for conversations around comprehensive sexuality education. But there are also so many networks. And of course, the moment you get plugged in into one organization, you'll get spaces into these other networks. And people can follow us on our social media
Mm-hmm.
pages, DM, engage, send us emails.
What are your social media pages?
For Aunty Jane,
Mm-hmm.
it's at you are Aunty Jane on Twitter and Insta, at YOURAUNTYJANE, at your Antigen one word, on on Twitter and Instagram. On Facebook, it is just Antigen Hotline. On TikTok, it's also at your Antigen. So those are spaces where people can engage in.
Mm-hmm.
And for a broader advocacy conversation, they can also follow at TICAH, at TICAH underscore KE. So yeah. And back to Auntie Jane. There are counselors on that other line
Mm-hmm.
who manage that project. So it's a whole system on its
What
own.
is the hotline number?
There is a toll-free number. The toll-free number is 0800 721 530. I'll take that again. 0800 721 530. That is a totally toll-free number. But there's also a WhatsApp number.
Mm-hmm.
And for the WhatsApp number, it's 0727 10 19 19. That is 0727 101919. Bongana Auntie Jane, that other person who's always there to listen to you.
Thank you so much, Mickreen, for your time. I feel like this has been a really great conversation. Of
Thank
course, we
you.
can talk about sexual and reproductive health all day
Yeah.
because it is a very important conversation. But I'm really happy with the work that you guys are doing.
Thank you.
And I hope that, a lot more of my listeners can plug in into the work that's being done. And of course, amplify the voices of, I guess, different Kenyans that are
Yeah.
interested in changing the way things are, because so far we have a long way to go
We
when
do.
it comes to just having adequate sexual and reproductive health care.
We do.
Thank you so much
Thank
for
you so
making
much
the
for
time. This was
hosting
amazing.
me. Thank you so much for hosting me.
Okay. And that's like short people from okay. I hope it's I'm trying to think. Can you hear me properly when I'm like this? Is this a weird angle? Okay. Wait, so I'm doing my outro or my intro? Outro. Okay, thanking her. Okay. So thank you so much, Mickreen. This has been an amazing conversation. I'm really excited that we've had it, and of course that there's ways to plug in to Antigen Hotline, Bonga na Antigen. And I'm looking forward to seeing the impact of the work that you're doing, and hopefully, of course, that we're going to be able to make progress in Kenya, especially when it comes to sexual and reproductive health. Thank you so much.
Thank you so much for hosting me. All right. So as we go to the talk,
I didn't even practice. Okay. Hi, this is Zeda Talks. Gosh, but now I got.
So the outro still. So you have
Is
to
this the
plug,
outro or the
yeah, you
intro?
have to plug your social media.
Oh no, I thought we're doing the intro.
The outro.
It's still the outro.
Yeah.
Okay.
So remember to follow.
Yeah. So this has been Zeda Talks. Thank you so much for watching. Make sure to check us out on social media. Follow us at Zeda Media on Twitter and on Instagram, as well as on Facebook. Our Facebook page is Zeda Media. Then, of course, make sure to subscribe to this channel for more amazing videos. Let us know what you liked about it, and of course, what more conversations you would like. And even if you'd like to be hosted on this platform, we are very open to especially women and anyone who's doing work around women. We'd love to have a conversation with you. Thank you.